Welcome to this episode of Youth Diary. Today we have Dr. Anish, who is a dermatologist with Kaya Clinic. So welcome to the show, doctor.
Thank you.
Well, today we're going to discuss the most common problem of any youth, you can say, because we're going to talk about skin, tanning, acne. I'm sure we have a lot of viewers this week for this particular show. Doctor, I would like to ask you the question regarding acne problems. Is it because of the eating habits of today's generation, or what is actually the reason behind?
Well, I'd like to begin by saying that we're beginning off the session with one of the most common conditions that we as dermatologists encounter in our practice, acne, which is more of a youth problem, as you were rightly mentioning. Now, what is acne exactly? Acne is a result of obstruction of the pores of your skin where it produces oil. Okay, the oil-prone sites of your body, like your face, your chest, your upper back, these are the sites where you get acne. And what results in acne? Not just the obstruction and the inflammation, but there is a super-added bacterial colonization that happens, a hormonal stimulation that happens, and all these together, an entire foray of things contribute to the manifestations of acne, which include the blackheads, the whiteheads, the pimples that you call, the pustules, nodules, cysts, and even scars. So acne per se is a physiological variation of a normal physiological process, but because of the disfigurement that it causes, you have to regard it as more of a disease. Now, the question that you asked is regarding the eating habits and its contribution to flaring up of acne. Now, a number of studies have been conducted in relation to identify a correlation between the dietary habits of people and acne, and more or less we rely on personal experiences, anecdotal reports which don't have a solid backup of scientific study. When people coming to your clinic tell you that eating chocolates exaggerate their acne, eating nuts exaggerate their acne, or eating egg exaggerates their acne. But there are few food items which have a scientific correlation in terms of exacerbating the disease, and that includes dairy products, which includes milk, and those foods with a high glycemic index. Now, glycemic index is a figure which indicates how much a particular food item can increase your blood sugar, and that includes refined carbohydrates. And put it in very simple terms, the more westernized your diet is, the more prone it becomes to acne. Okay, so the more pizzas and hamburgers that you take, the more colas, the more Pepsis, that becomes a more acne-prone diet. So my advice to the youth would be to cut down on all that junk food, the bakery food.
Yeah, you can't really completely avoid it, so cut down on it.
No way, you'll have a school get-together tomorrow at Pizza Hut, what will you do? So yeah, obviously, you can't cut down totally on these food, but that is what you need to focus on if you're trying to control acne in terms of your dietary habits.
So doctor, again, the next problem that we can hear from every person is about tanning. Okay. So that means that we can't really step out of the house because of the sun problems and all, sun rays and all. So how do you think, the sunscreen lotions are a remedy to this, and so it can really help us, and what are the after effects? So
yeah, as you mentioned, tanning is something that the generation today is like phobic about, The irony is that it is a protective mechanism. Tanning, the process by which the skin darkens when you get exposed to the sun, is a protective mechanism. It helps us to protect ourselves from the harmful effects of solar radiation. So the very fact that we Indians have got more melanin, which is the pigment that causes our skin color, the very fact that we have more melanin means that we're better protected from the sun than, say, the European rays or the Caucasian rays. So rather than lamenting about the fact that we've got more melanin, hence our skin is 1 or 2 shades darker than the Europeans, we need to be thankful to the Almighty that we have got more melanin and to be protected from the harmful effects of solar radiation, especially the ultraviolet rays, and even protecting us from things like skin cancer. So we need to be thankful to God Almighty for the melanin that we have. And regarding the use of sunscreen, that is one thing that you can use to protect yourself from tanning or preventing your skin from darkening when exposed to sun. Now, the sunscreens there are different types of sunscreens. You've seen physical sunscreens like titanium dioxide, zinc oxide, which are applied by the cricketers. Sometimes the cricketers apply a lot of sunscreen on their skin, but that is not cosmetically acceptable because you have to apply a lot on your skin and becomes visible, so that it is not cosmetically acceptable. The ones that are commercially marketed, the sunscreens, are the chemical sunscreens. So we have to apply very little quantity of it to actually offer protection to the skin. And now, how much of sunscreen will we apply is one question that everyone asks. Now, according to textbooks, it is 2 milligram per centimeter square, but that doesn't make much of a sense, does it? So I would say approximately 3 ml, which would be like just more than half a teaspoon. Yeah, that would be enough. That much amount of sunscreen would be enough for the face and the neck. And next, the question everyone asks is, what SPF sunscreen did we use? The common label that every sunscreen has.
SPF. Is it 50 or 35?
Yeah, 15, 30, 50. You have different figures. Now, for Indian skin, for routine use, SPF 15 sunscreen is more than enough. Now, unless by means of lifestyle or occupation you have extra exposure to the sun, or you are getting exposed to the sun for prolonged periods, SPF 15 is more than enough for you. But in case by occupation or by lifestyle you have more exposure to the sun, probably you go for a higher sunscreen, higher SPF sunscreen, like SPF 30. And well, the thing is, the difference is very marginal. You know, SPF 15 sunscreen would offer you 93% protection from UVB rays, and an SPF 30 would offer you protection of 97%. So that difference is very marginal. It's not like 15 and 30 has a difference of, you know, a doubling effect. So that is a misconception that people have. And another thing that you need to be aware of is the retention of the sunscreen. You know, you sweat a lot, especially in hot and humid climate like in Kerala, you sweat a lot and you lose the sunscreen. So reapplication of the sunscreen, like every couple of hours or every 4 hours at least, is another necessity, so that the sunscreen gives you adequate protection. And when do you apply it? You need to apply a sunscreen at least 30 minutes before you get out in the sun. You need to give the sunscreen that time to form a protective film, and only then will it be effective. So these are some of the guidelines that we use regarding the use of sunscreen. So yeah, that's it.
So we have few questions from the audience side. The first question goes like this.
I'm Shabin Abraham from KMA Engineering College. So I have a question for you. My question is regarding the use of lasers in hair removal. And will it have any long-term damage to our skins?
There are a number of methods that we can adopt to remove unwanted hair. It becomes a problem especially in females and even in males. Some of them do not want body hair, some of them want to shave their beards. The hair removal is a process which is applicable to a lot of people. And apart from the mechanical processes like normal tweezing or shaving or waxing, these are all uncomfortable procedures and they are very temporary. So we would like to have a more comfortable kind of method to remove unwanted body hair with sustained results. And one of the options that we have is lasers. We have different types of lasers that are available for hair removal. Okay, for example, you have the Nd:YAG laser, you have the diode laser, the different types of lasers using different fluences, different methods to control hair growth. Now, just one session of a laser will not suffice to get a sustained reduction in hair growth. You would need multiple sessions. So the obvious question arises, long-term use of laser, how much damage is it going to do to my skin? The answer is that laser beam is very precise. It would target only that pigment, the melanin pigment contained in the hair follicle. It will not affect your skin in any way, the surrounding skin in any way. The laser energy is not absorbed by any of the surrounding skin or surrounding structures around the hair follicle. It targets specifically the hair follicle, and hence the answer to that question would be lasers in the long term would not cause any damage to your skin. It specifically targets the hair. The only thing is you can have some immediate effects. If the fluences are not set right, if you're not in experienced hands, you can experience a burn while doing a laser. But that's not a long-term thing. You know, it happens during the procedure. So long-term, there is hardly any side effect that you can have with the laser in terms of you affecting the skin.
The next question is this.
Hello, my name is Vishnu. I am from KMA Engineering College. I have a doubt for you, doctor. What are the adverse effects of hair dyes?
Hair dyes. Now, hair dyes are very commonly used cosmetic, not just among the people who are, you know, of the graying hair age group, also among the youth of today, where premature graying is becoming more rampant, mostly related to genetic issues. But premature graying is one situation where the youth also depend on the use of hair dyes, not just for cosmetic coloring of the hair, but also for reasons of premature graying. When an Indian ages or grays his hair before the age of 30, it means he has premature graying. And one of the ways to counter that is cosmetic camouflage in the form of hair dyes. It's a very difficult condition to actually treat, although you can supplement some agents like PABA or calcium pantothenate. Still, it's very difficult to control. So the best thing to do is go for a cosmetic camouflage, and the best thing to do is to use hair dyes. And what are the adverse effects of hair dyes? Now, adverse effects of hair dyes are mostly related to the components of the hair dye itself. Now, the most common encounter that we have with someone using a hair dye is an allergic contact dermatitis, that the person has developed an allergy to one of the components of the hair dye. And the most important component which is responsible for this is what we call the PPD, or the paraphenylene diamine. Now, paraphenylene diamine in the hair dye is the most important culprit to cause an allergy to the same, and hence There are a number of dyes available in the market today which are PPD free. It's specifically written on the label PPD free. So I would advise everyone to go for the PPD free dyes so that you don't get an allergy to it. And the other thing is, what kind of damage does it do to the structural integrity of your hair? And some of the components, like example ammonia, which is actually used in the hair dye to penetrate the cuticle so that the dye gets into the hair. What this does in the long run is it affects or tampers with the normal structural integrity or the physiological structure of the hair. So in the long term, it can cause thinning of the hair, fragility, and even can lead on to breakage and hair fall. So the another content of the dye that you need to be aware about is the ammonia. So what we have in the market today, we have a lot of products. We have products with ammonia free, PPD free. So in terms of efficacy, these dyes which are ammonia free, which are PPD free, might be lesser in terms of the normal hair dye. But then you better be safe than sorry. Why damage your hair? Even if the dyeing effect is a little less, I think it's better to go for a dye which is PPD and ammonia free. And we also have vegetable oil based dyes, which that is also available. So I think people should go more for chemical free, safer hair dyes should be the option. These are some of the adverse effects that can happen, and you need to be aware of it.
Next question is this.
My name is Abhilash Anand. I'm from KMU Engineering College. Is dandruff effectively curable, doctor?
Okay, being a dermatologist, you wouldn't possibly escape this question. Dandruff, again, one of the most common clinical conditions that we encounter in our practice. Now, dandruff is the mildest manifestation of what we call seborrheic dermatitis. Now, seborrheic dermatitis is an inflammation of the skin which affects the seborrheic areas of the body. Seborrheic areas, I mean the scalp, the face, the central chest, the back, the flexures like the underarms. These are all seborrheic areas of the body. Now, what people refer to as dandruff is the mildest variant of seborrheic dermatitis. It just refers to the tiny scaly flakes of skin, the white flakes of skin that you see on hair-bearing parts of your body, like the scalp, the eyebrows, the eyelashes. And sometimes you find them deposited on your collars, on your shoulder, That's what you call dandruff. Now, dandruff, what causes dandruff? Understanding of the term dandruff is very important in terms of its management. Now, dandruff is caused by a fungus, which is a normal commensal resident of your skin, of a healthy individual skin. The fungus is named Malassezia, some call them Pityrosporum also. And this fungus is basically responsible for the dandruff. But the fungus alone won't do, because all of us have that fungus. You have, I have. But not all of us have the same manifestations of dandruff. It is about how your immune system, or your defense system of the body, responds to this fungus. That is what leads to the various manifestations of seborrheic dermatitis, the mildest of it being dandruff. Now, the question arises, can we transmit dandruff? That is one question that everyone asks. Now, as I mentioned, it is your own body's defense system or the immune system that is responsible for dandruff. This fungus everyone has. You needn't acquire it from anybody. So, having said that, when people say sharing a comb with a person with dandruff, sharing a towel, sharing a pillow cover, sharing the same space, that will not transmit dandruff, because you already have that problem within your system. It is not something that is acquired from someone. So dandruff is not a contagious disease. You don't have to worry about mingling or being with someone who has dandruff. Another obvious question that props up about dandruff is, can you cure it? The unfortunate answer is no. You can only control your dandruff. There is no permanent cure. And how do you control dandruff is the next question. I usually advise people to use normal shampoos, normal commercially available shampoos, like 3 times in a week. If they can control their dandruff with that, it's fine. But in case you find that it is not possible for them to attain sufficient control, that it's still flaking up on your shirt, sleeves and your collars, then probably you need to go for anti-dandruff shampoos, which are basically antifungal agents, because you're planning to target this fungus that you already have. So anti-dandruff shampoos are generally used twice in a week. We advise them to usually use it like about 5 minutes before you take a bath. Ask them to rinse their hair, apply the shampoo over the scalp. It shouldn't be just left on your hair. It should be applied onto the scalp. Wait for 5 minutes and wash it off, like a normal process. The only disadvantage of using an anti-dandruff shampoo probably is that it affects the texture of your hair. But most of the commercially available anti-dandruff shampoos these days have associated conditioners in them, which takes care of that. Or if you find that still you find that the hair is rough, you can use conditioners after you apply the shampoo. Another thing is, some people experience hair loss when you use anti-dandruff shampoos. All you need to do is dilute the shampoo, like in 1:2 with water, and then use it. That will more or less solve the hair loss issues associated with anti-dandruff shampoos. And now that antifungal alone would suffice if it is limited to this flaking, that is just dandruff. But if for more severe manifestations of seborrheic dermatitis, like you have an inflammation, you have a redness, you have severe itching, probably we need to combine a few other components in your medication, like maybe even topical steroids are indicated in the management of dandruff.
So added to this, I have one more question. Are there hair oil? A lot of companies, they come up with good hair oils, and also, do you think really that is helpful for reducing dandruff?
That's a good question coming from this part of the world, Kerala. People are obsessed with using hair oils. Well, I wouldn't really want to comment about the advantages of hair oil. Probably they do have some effects on nourishing the hair. But as far as dandruff is concerned, hair oil is an absolute no-no. Because this fungus that I mentioned, Malassezia, which causes dandruff, is a lipophilic organism. By lipophilic, I mean they feed on lipids. Now, oil is a very rich source of lipids. So what you're basically doing by applying hair oil is feeding that fungus. So it is just a false feeling of, cure from dandruff when you apply hair oil. What happens is that obvious flaking is not there. Everything sticks onto your scalp and you don't realize that you have dandruff. But it's just a false feeling. What you're actually doing is exacerbating the disease. So probably it's a no-no zone as far as I'm concerned with dandruff. Yeah.
The next question is about this.
So my name is Sharath S. I'm an engineering student of KME Engineering College. I have a question regarding what kind of ideal soap or cleanser to be used and dry skin management.
Now, almost everyone asks us this question, which is the ideal soap or cleanser that I can use for my skin? It's a very common question that people ask us. Now, before I tell you about it, I would like to tell you what exactly is the damage that a soap or a cleanser can do to your skin. As you all know, soap is a mixture of fats and oils and alkalis. It is basically, technically speaking, it is a fatty acid, sodium salt of a fatty acid, which is an alkali. Now that itself is harmful to the skin. When you apply an alkali to your skin, the normal pH of the skin is slightly acidic. So when you're applying an alkali to the skin, you're actually irritating the skin and making it prone to cutaneous infections. Another factor about soaps is that it is a defatting agent. It disturbs the normal oily film that you have on your skin, okay, which helps in retaining moisture. So that ability of the skin to retain moisture is lost when you apply the soap, and it makes the skin dry. So these are the two main adverse effects that your soap can potentially cause to your skin: make it dry and make it alkaline. And of course, you can develop an allergy to any of the components of a soap. Soap has multiple components. It has fragrances, it has got colors, preservatives, lathering agents, a number of components. You can develop an allergy to anything under the sun, including the sun. So you wouldn't probably want to blame your soap for developing an allergy to it. So the two main issues here are alkalinity and the dryness. Having said that, there is very little contact time that a soap has in your skin. When you in a bathing session, how long would you apply a soap? Hardly a minute before you're lathering off and washing it off. Yeah, so the contact time is not sufficient enough for the soap to cause any significant damage, provided your skin is normal and healthy. But the situation arises when your skin is sensitive. When your skin is sensitive for reasons of genetic problems, or because of conditions like atopic dermatitis and ichthyosis, or when the climate is dry. When your skin is already dry, applying a soap over it might cause extra damage. That is the situation when you probably want to choose the type of soap that you're using. One of the choices would be to use a glycerin-based transparent bar, okay, which is an ideal soap. A glycerin is a good moisturizer which would mildden the irritant effects of a soap. And there are these new products known as synthetic detergents or synthets. Now they basically same components that they derive from oleochemicals and petrochemicals, but they don't undergo this process of saponification, as in they're not alkalis. So they do not alter the pH of the skin and can be used safely. So that is one option that you have. Another situation where you probably want to choose a soap that you use is when your skin is photosensitive, as in exposure to the sun is giving you a rash. Okay, that is a situation when you wouldn't want to use a soap which has components which would further photosensitize your skin. For example, soaps containing turmeric. A lot of the marketed soaps today contain turmeric. Now, turmeric is an agent which would photosensitize your skin further, and you wouldn't want to use it if you have a photodermatitis, as in you're allergic to the sun. So there are very few situations where you would want to choose an ideal soap, an ideal cleanser, a milder soap, a milder cleanser. But otherwise, more or less for people with normal healthy skin, you really don't have to bother much about the soap you're using. You can use any soap according to your aesthetic preference, according to the fragrance you need.
Only the dry skin part.
Yeah, only people who have a sensitive skin issue, as in dryness or photosensitivity, that's when you really need to be concerned about the kind of soap you're using or the cleanser you're using. Otherwise, more or less, we get away with most things, as in the components of the soap. Yeah, so that's it.
Thank you so much, Doctor, to spend the time with us here and give us valuable information regarding the skin management, which is kind of a most important factor, a thing in our life. So while we come to an end of this show, actually, I think you have a lot of questions in your mind more. So don't worry, you can always send us through emails. You can email us on youthdiaryroseball@gmail.com. We'll be here with your answers next week. Till then, bye-bye.